Hey everyone, today I'm actually just sharing a case study about somebody with one-sided arm pain. I'm going to tell you about their symptoms, a little bit about the journey that they went on before they came and found us at this office. If this sounds like you, I want you to stick around because I'm going to take you through just a little bit of an assessment to see if you also have the same type of response. And if you do, I would love you to just give us a call and we can help guide you in the right direction to help get you back to recovery. My name is Dr. Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa, California. You guys like this video? You want to know a little bit more about what you can do for this issue? I mean, calling us and having us guide you in the right direction is also is always the best choice, but there's tons of free content out there that you have to cipher through. Just go on our channel, search in the search engine, whatever symptoms that you're dealing with, there's going to be some videos that pop up that are going to help you. We have tons of them. They're there for a reason. Take advantage, okay? Person calls me one day and says, I have arm pain. I've rested. I feel okay right now, but anytime I want to get back into my activity, it prevents me from being able to do so. This person was a CrossFitter, did some overhead movements. It was slowly, gradually coming on, so there wasn't like one specific incident that hurt. But when it did come on, sometimes it moved around. It was like, it's in my armpit. It might be on the back side of my arm. Sometimes it goes all the way down into my fingers. Sometimes it's on the front of my arm. Sometimes it just doesn't even pass my elbow. Dependent upon the day is how the symptoms changed. There was no pattern to it for this person. This person had seen PT, nerve specialist, gotten imaging done of the shoulder, gotten some NCVs done, which is a nerve test, had seen an ortho, I don't know if I already said that, had just seen a lot of people, been a lot of places, had no answers, and nothing was working. So as we spoke on the phone, I said, just come in for an exam. It sounds like there's an area that nobody has looked at yet. I want to examine that area and see what happens. So again, if this sounds like you got the arm pain, you're struggling to get back to your activity or whatever it may be, then let me take you through this little assessment and let's see what happens, okay? So because the pain was just in the arm, everybody wanted to look from the shoulder down. So I want you all to go through this very carefully, okay? And always seek medical attention before performing anything like this, okay? But I want you to go ahead and look down nice and slow and see what happens. Sometimes we may be recreating some arm pain, but maybe we might be creating some associated symptoms like, on the same side of my arm pain, I feel some neck tightness or shoulder blade tightness, or maybe right in between the shoulder blade and the spine, there's some tightness there. Check in, let's see what you're feeling. So looking down, how is that? Looking up, how is that? My patient that I'm talking about, this one lit them up, okay? We went backwards and he was like, that is my pain. How has nobody found that looking backwards is what creates my pain? We did a little side bending and we did a little rotation. We did armpit sniff on both sides. And then him being in here, we also took him through compression of all of those same directions, did a full neurological exam, and now he was aware that these symptoms are coming from the neck. So we treated the neck instead of him having to do surgery or other imaging to go through. We found it here. We did therapy of here. We strengthened through here. We strengthened through the shoulders, and now he is back at his CrossFit gym. So if you felt something into the arm doing your head range of motion like this, or associated symptoms like shoulder blade, upper trap, neck on the same side of the arm pain, you need to be in here. You need to let us examine you. You need to let us do a full neurological exam on you and help guide you in the right direction, okay? So simple educational video today, nothing crazy for you to try, just could also be just very enlightening, like, oh my gosh, I didn't know this could be coming from my spine. So we do work with people virtually, also in person. You're near us, come see us. You're not near us, we can still help you, take you through a movement assessment, find what's right for you. Talk to you guys soon.